Hello, the internet world out there. Brittany back. So, I have a new video. I know I said I would make another video when things are doing good. Not quite there yet, but we'll do another one and I'm going to rant for a little bit. This video, I know many can relate to, but I really hope that you don't relate to. Is that lately I feel like, most specifically recently, the healthcare system, or specifically one doctor of mine, has really failed me. And this is the first time I've had to fire a doctor. I work in healthcare myself, so I don't take lightly reporting someone. I've never at all had to call and complain about a doctor or fire them, and this is the first time I did, and wrote a terrible review just because I don't want others going through what I went through. I think my last video I'd mentioned, where since my surgery that I had, I've been getting recurring vaginal infections. So anyone who doesn't want to hear about this, you can obviously turn it off now, but I'm just trying to normalize it. So I guess one good-ish news is my wound on my bottom is healed. Yay! One thing, yay! I really thought that was what the cause was of all my infections, but that's been healed, and I've still been getting bacterial vaginosis around the clock. I want to say at least 6 or 7 times within 3 months. So I start medication, I feel good while on medication, and about a day or two after the round is done, it comes back. And then I get put on medication again, and then a day or two after it's done, it comes back. Then I get put on medication again, and after a day or two, it comes back. So I had an appointment with a doctor last week, or it was like a week and a half ago. I don't quite remember. And it wasn't last week, but the week before. So I had made an appointment with the gyno. I've seen her before, but last time was someone different, and then I saw her again. But I didn't really like her from the beginning, but it wasn't too terrible. And I sat there in her office saying, okay, something's going on. Another infection. So she's like, oh yeah, I'll swab you for BV and yeast again and see what it is. And I said, well, no, I know it's an infection, but I need to figure out why this keeps happening. Maybe too personal information, but anything the gyno tells you to do for health down there, I do strictly. Baggy pants, only cotton underwear, sleep naked without underwear, shower, don't sit in bathtub water, don't douche, don't wash with soap down there. Even my body soap, I use scent-free Dove soap. I don't mess with things down there. I've barely had sex. And this started before I even started to have sex again, so I don't know. Take a probiotic every day. I've started to use Refresh gel, like she suggested. Second it's done, comes right back. So it's in a doctor's office. She swabs me again and says, okay, yeah, it looks like BV, so let's get you on some medication. And I said, okay, that's great that we can do that, but I know the second I'm done with it, it's going to come back. So what can we do? So rather than saying, well, let's talk about it, she goes, well, that's not my job to figure out. That's for you to figure out. I said, well, my pH is off. Something, because that is obviously the root cause, right? It's not just an infection. The pH is off. Something is causing it to be off, which gives me the infections. So figuring we could have a conversation, maybe do further testing, where is this coming from? And she's like, no, that's not my job. That's for you to figure out why you're getting so many infections. You are the specialist. I don't understand. I understand I'm a rare case. I understand it's hard to treat me. I get that. But I judge a healthcare provider not based on the knowledge that they know, but the willingness to do tests and figure it out with you. To just tell me, well, not my job. Who else do I go to? I'm actually asking you, internet, who else do you go to for vaginal problems but a gyno? So I was pretty much in tears ending the session because I'm like, wow, am I supposed to live literally with an infection the rest of my life? Like, is that just a thing that if I just keep coming back to her, like, just another round of antibiotics, okay, and another one, and another one, and another one? No, there was zero discussion. So, fortunately, I had a rheumatologist appointment later on that day, which is, I feel like my rheumatologist has become my primary care, I guess, which is not her job, but she's great. And she fucking did tests. Like, I go in and I'm like, okay, my gyno literally told me she can't do anything for me. No further testing, no nothing. So at least she got me on something slightly different, metronidazole vaginal gel. Was on it for 5 days, like she said. And 2 days later, came back, like I expected. So I'm still waiting for results from my rheumatologist. But at least she was like, no, something's off. She's like, it's nothing you're doing. Something is being all messed up. So we're going to do some tests and figure it out. It's like, my fucking rheumatologist, that's not her job. I mean, thankfully I have her. And I got a referral for a better one. Hopefully they're better. I see them this coming Friday. But until then, I've got to wait with being super uncomfortable even more and longer, because apparently a gynecologist can't do further tests to figure out why you're getting infections. I'm not gonna say, I guess here, in case there are people I don't know following me, where I'm from, but if anyone sees an Amy Santoro, never see her, because she will not be in your corner and treat you like you do things wrong. Like, for her to say, well, I don't know, that's not my job, that's for you to figure out. Like, no, screw you, lady. That's not... My job is to have discussions with you to figure this out. You're a doctor. I'm a PT. Like, the best analogy I can give is a patient coming in to see me with knee pain and me looking at them and being like, not my job, that's for you to figure out why your knee hurts. Do I know within the first visit why their knee hurts? No. It may take me time to figure out. Maybe it's their ankle. Maybe it's their hip. Maybe they have an old head injury. You know? Like, right, I figure this stuff out. To day one be like, no, I don't know what's coming from, so that's your job to figure out. So I really hope no one has that experience like I have, and it's been really bothersome because, like, I can't sit comfortably. And it really, affects my dating life really tremendously. But, what are you going to do? I'm just hoping Friday I get some sort of answers or relief. And even if it's not answers or relief, at least some sort of plan of trying to figure it out. And God, I hope this person's better. I don't want them to just look at me and be like, oh, you have BV, so here's an antibiotic. No, like, why have I had it for 3 months? Maybe some sort of antibiotic resistant. I don't know. I know not many of you guys follow me, but if any of you had a similar problem, please let me know. Because, like, I'm at my wit's end here. So all I can hope is that everyone else has, like, really great doctors. And yeah, don't be afraid to stick up for yourself. Like, in the middle of that session, when she's like, nah, it's for you to figure out, I said, no, like, I need to know we can do something. And she thought the gel would be better than the oral antibiotic, but apparently she was wrong. Which is fine to be wrong, but you gotta work with me and figure it out. Because if I just keep coming every 2 weeks with an infection, like, how is that doing anything? But she's great for if you're having babies and annual routine pap smears. Other than that, she's not going to figure stuff out. Unfortunately, that's just the experience I've had there. And it really sucks. So far, literally my rheumatologist, NP, is the only person I trust. And unfortunately, that means I go to her for everything, even when it's not her job. But, like, you gotta have people in your corner, and she's the only one I feel like is in my corner. I've had just bad experiences up the wazoo with other people, which kind of makes me want to be a better healthcare provider myself. Like if I think back 5 years ago when I was treating, yeah, I probably was doing the bare bone. Oh, your knee hurts? Okay, like let's try this. Here are some knee exercises. I'm going to stretch your knee. But it really makes me strive for the above and beyond. Like, no, why does your knee hurt? Pain is a symptom, not a problem. Treat the problem, the symptoms get better, which is an example of my infection, right? You can keep treating the symptoms, give me the applicators, the gels, but the second it's done, it comes back. So what is the root problem? What is the root cause? And if any other healthcare providers are listening to this, strive to be better for your patients. So that's what I do every day. I just came from an 8-hour class to learn more, and I have another one tomorrow. Like, it's super exciting and super uncomfortable to do it when you're, also really uncomfortable at the same time. But if this reaches anyone, like, strive to be better for your patients. And any patients out there, strive to advocate for yourself. Like, if this was 2 years ago, I just would have literally just walked out in tears and did nothing and just cried. But, I was like, no, what are we going to do? And since she wasn't willing to go further, I'm like, great. I will take matters into my own hands. Got a referral from a rheumatologist to a better place, and my rheumatologist did tests. So that's what I have in my control. And that's what I just have to think and be patient until Friday. But I will definitely keep you guys updated. Not like you really need to know, but, I know ranting here, it helps me. Hopefully it's somewhat educational for other people, from being patients or healthcare providers, but overall people, just providers, strive to be better. There's always room for improvement, and you're really going to make a patient's day. Because when a patient's there to see you, they're not there to have fun. They're not there because they want to be there. They're there because they're in need, and for you to disregard them, if you disregard them, it's just heartbreaking. And God, I hope I never do that to a patient. I'm sure I have. But that's why from here on out, like, strive to be better, strive to advocate for yourselves, because you deserve better. Literally, in my class today, we were talking, my boss was giving a class. Again, I'm a physical therapist. And we were talking about, like, the idea of failed back surgeries. Failed back surgery is not a thing. It's really a failed healthcare system. So many of us have failed them before they got to that point. Like, if a person gets back surgery and it doesn't work, well, maybe it wasn't their back. Maybe it was they had an ankle sprain 10 years ago and wasn't treated. So they probably had seen massage therapists first, us as PTs next. Maybe saw chiropractors. So by the time they got to the surgeon, it wasn't the surgeon's fault. Maybe they didn't need fucking back surgery to begin with. Maybe they just needed someone to fucking fix their ankle. Sorry, a lot of F-bombs are going off. So this whole thing, our healthcare system needs to be better. And I see that, and I'm in it. And all we can do is strive ourselves to be good for our patients. So that's my little tidbit. And I hope you all learned something today. And I really, really hope by the next video I share or do, it'll be a wonderful video. But overall, even though I'm struggling right now, I'm okay. Not like last video. So I can only control what I can control. And yeah, I'm uncomfortable, but I can't worry now until, I've done what I can do. I've made an appointment with another physician, hoping I get better results. So, you all have a wonderful night, and I hope you all are having actually a good and healthy spree. I hope you guys are feeling healthy, because that's a good feeling to have. Even though I don't feel healthy right now, but I really hope others feel healthy, because it sucks to not feel healthy. I haven't felt healthy in years. But you take the good days when you can take them. So, you all have a good night. Love you all.